Hey everyone, welcome back to Body Buddy. I'm your host, and today we're talking about something close to all of us, our heart health. Our heart is the engine that powers our lives, pumping life-giving blood to every corner of our bodies. But sometimes, it sends us signals that something isn't quite right. So, in this video, we're going to delve into the top 10 signs that your heart might be trying to tell you something important. Our heart is the engine that keeps us going. So, let's jump right into the signs you shouldn't overlook. First up, if you feel pain, pressure, or tightness in your chest, it's time to take notice. This discomfort can sometimes be brushed off as indigestion or stress, but it's crucial to understand that it can also be a sign of something more serious, a potential heart issue. Chest discomfort is often described as a feeling of fullness, squeezing, or a heavy weight right at the center or left side of your chest. It may come and go or persist for several minutes. While it's true that heart-related chest discomfort can vary greatly, any unexplained chest pain should be evaluated by a healthcare professional. It could be your heart's way of signaling an underlying problem such as coronary artery disease or even an impending heart attack. So if you experience chest discomfort, don't ignore it, seek medical attention. Difficulty breathing, especially during regular activities, could be a sign your heart is working harder than it should. We all experience breathlessness from time to time, typically after a run or a strenuous workout, but when it happens during activities you could easily do before, like climbing stairs or walking your dog, it's time to take note. Shortness of breath can be a symptom of various heart-related conditions, including heart disease and heart failure. It could mean your heart isn't pumping blood as efficiently as it should. This inefficiency can cause fluid to build up in the lungs, making it harder for you to breathe. Remember, it's not about being overly alarmed, but about being aware. Listen to your body, and don't dismiss changes in your breathing patterns. It's always better to err on the side of caution when it comes to your heart health. Pay attention to shortness of breath. Palpitations or irregular heartbeats might be a sign of arrhythmia. But what does this mean exactly? Well, our heart beats in a steady rhythm like a metronome. This rhythm is essential for efficiently pumping blood throughout our body. Sometimes this rhythm can get disrupted, causing the heart to beat too fast, too slow, or irregularly. This is what we call an arrhythmia. It's like the drummer in a band missing a beat or two, throwing off the entire song. Arrhythmias can come from various factors such as stress, caffeine, or underlying heart conditions. Some people might feel like their heart is racing, fluttering, or they might not feel anything at all. But regardless of the symptoms, any disruption to our heart's rhythm is worth paying attention to. It's our heart's way of telling us that it might need a little help. Check in with your healthcare provider if you notice anything unusual. Feeling tired all the time beyond the usual reasons might be a signal that your heart needs some attention. When we talk about fatigue, we don't mean the typical tiredness you feel after a long day or lack of sleep. This is an excessive, persistent sense of weariness that doesn't improve with rest. It's a kind of fatigue that leaves you drained, affecting your ability to function at your normal levels. You see, your heart pumps blood, supplying oxygen and nutrients to your body's cells. If your heart can't pump blood efficiently, it could lead to reduced oxygen and nutrients reaching your cells, leading to fatigue. It's your body's way of telling you that something's off. This doesn't mean that every time you're tired, it's a heart issue. Fatigue can be due to many reasons, but if it's accompanied by other symptoms like shortness of breath or chest discomfort, it's time to consult healthcare professionals. Listen to your body. Dizziness or fainting could indicate inadequate blood flow to the brain. These symptoms are often overlooked or chalked up to simple fatigue or overexertion. However, if you're experiencing frequent bouts of dizziness or have fainted, it's crucial to understand that this could be a sign of a more serious heart condition. When the heart struggles to pump enough blood to meet the body's needs, it can result in reduced blood flow to the brain. This may cause you to feel lightheaded or even faint. Remember, your brain relies on a steady supply of oxygen-rich blood to function properly. When that supply is disrupted, it can lead to symptoms like dizziness and fainting. So, if you're frequently feeling dizzy, or worse, have episodes of fainting, don't dismiss it as nothing. It might be your heart sending you a signal. Don't dismiss these symptoms, get them checked out. Keep an eye on swelling in your legs, ankles, or abdomen. This might seem like a minor inconvenience, but it's not something to brush off. Swelling, also known as edema, could be your body's way of signaling that your heart isn't pumping blood as efficiently as it should be. When the heart can't keep up with the body's demands, it can cause a buildup of fluid in the tissues. This fluid accumulation often manifests as swelling in the lower parts of the body due to gravity, specifically the legs, ankles, and abdomen. But how do you discern normal swelling from one that might be a heart health alert? Well, if the swelling is accompanied by other symptoms such as shortness of breath, fatigue, or weight gain, it's definitely time to pick up the phone and schedule a visit with your healthcare provider. Remember, it's always better to be safe than sorry. It could be a sign of fluid retention, a common symptom of heart failure. A persistent cough, especially with pink or white mucus, might be a sign of heart failure. Now this might surprise some of you. After all, we usually associate coughing with colds or allergies, but the heart and the lungs are intimately connected. When the heart struggles to pump blood effectively, fluid can back up into the lungs, causing shortness of breath and a persistent, often dry cough. This cough can sometimes produce a frothy pink or white mucus. This is due to blood leaking into the lungs, a serious condition known as pulmonary edema. If you've noticed a persistent cough that just won't go away, especially if it's accompanied by other symptoms like fatigue, shortness of breath, or swelling in your legs and ankles, it's important to seek medical attention. Remember, your body is always communicating with you. It's up to us to listen and respond. Don't hesitate to consult with a healthcare professional. Sudden and unexplained weight gain, paired with swelling, could signal fluid retention. This isn't about those extra pounds from holiday indulgence or skipping a few gym sessions. We're talking about a rapid increase in weight over a few days or weeks. This kind of weight gain can be a red flag when it comes to your heart health. Fluid retention, or edema, is often a sign of strain on the heart. When the heart can't pump blood efficiently, fluid can build up in the body, leading to sudden weight gain. This is often accompanied by swelling in the legs, ankles, or abdomen. It's not just about the numbers on the scale. If you're noticing puffiness or swelling, particularly in your legs, ankles, or feet, it's critical to bring this to your healthcare provider's attention. This isn't meant to alarm you, but to remind you to listen to your body. It knows when something's off. Monitor your weight and consult with your healthcare provider. Persistent nausea or loss of appetite might be linked to heart trouble. It's easy to dismiss these symptoms as the result of a stomach bug or a bad meal, but they could be signaling something far more serious. When your heart doesn't pump blood as effectively as it should, your digestive system can't get the blood it needs to function properly. This can lead to feelings of nausea or a decrease in appetite. Moreover, certain heart conditions can cause fluid to build up in the abdomen, making you feel full or nauseous. If you're experiencing persistent nausea or appetite changes, especially when coupled with other heart health warning signs, it's important to seek medical attention. Your doctor can help rule out heart conditions and guide you on the right path to heart health. Remember, your body has a way of communicating when something's off. Don't ignore changes in your digestive patterns. Last but not least, pay attention to pain or discomfort in the jaw, neck, or back. You might be surprised to learn that these aches aren't always due to strain or overexertion. In some cases, they can be a sign of an underlying heart condition. Such discomfort may occur during physical activity or emotional stress, and can feel like a pressure or tightness. It's crucial to remember that heart-related discomfort can radiate beyond your chest. This is because your heart and these other areas of your body share a complex network of nerves. So, when your heart is under duress, your brain might interpret the pain as originating from your jaw, neck, or back. Don't dismiss these signs as mere muscle tension or fatigue. If you experience persistent or recurrent pain in these areas, especially if it's accompanied by other symptoms we've discussed, it's essential to seek medical advice. Sometimes heart issues manifest in unexpected areas. Those are the top 10 signs your heart might be sending you a message. From chest discomfort to unexpected areas of pain, it's crucial to pay attention to these signs as they might indicate underlying heart issues. Don't neglect your health or ignore these signals. Your heart is the engine that keeps you going, and you need to keep it in peak condition. Remember, early detection and prevention are crucial. If you notice any of these signs, consult with a healthcare professional.